Here's the easiest way to get quick upper back pain relief from T4 syndrome. You need to do a subtle slouch. That's the solution. All you have to do is, if you think about your chest and shoulders, you have to subtly slouch. Not a full all-on slouch, like super terrible bad posture. It's just a subtle slouch, and it even helps if you suck in your abs slightly. If you just think about pulling your belly button in, that makes your ab muscles right here shorten this way, which pulls your rib cage down and helps you to create that nice little baby slouch. When you do that slouch, you should feel instantly that back pain that comes on right in the middle of the upper back, it should reduce, and in many cases it'll even go away completely, at least for moments. This is really important because so many people with T4 syndrome have a really hard time finding a comfortable position to be in. They often think that it's their chair, it's the pillow that they use at night, the mattress that they're sleeping on. All those factors are typically not the main problem when it comes to T4 syndrome. It's that there's too much pressure on the disc in that mid part of the back, and there's stiff joints above and below the spine that are causing too excessive motion to happen here in this part of the back. Now, let me tell you how slouching helps. When you do that subtle slouch motion, of course the abdominal muscles are pulling the rib cage on the front and it's bringing the upper part of the rib cage forward. And because the vertebrae, the spine bones back here, are relatively on the back part of the body, you can actually offload the discs of the spine when you do that. Offloading the disc is important because that allows it to heal. Discs are designed to absorb pressure and spread it out in different directions in a good way. So if a disc is injured, the solution to healing it is to offloading it so that it has space to not have to do the work that it's supposed to be doing. Now, another phenomenon that happens, but you might have a hard time finding this on yourself, is if you think about this part of the spine where the rib cage is, it's called the thoracic spine. And it's got a little bit of a curvature outwards towards the back, like if you think like the Hunchback of Notre Dame or rounded back posture. That's the position that it's supposed to be in. But in people that have T4 syndrome, what I tend to see is that this part of their back is actually flattened out and they've lost curvature. They might have a curvature up here, but then it gets flat right here, and then they have the inward curvature that happens in the lower back. So when I'm examining these people as a physical therapist, I'm looking for the curvatures, and I'll usually feel a flat portion, and it's in that flat portion that I'll poke around and find the level of the spine that's most involved where the T4 syndrome is happening. It's not always T4 exactly. It could be T3, T4, T4, T5, even T5, T6, or neighboring areas. All that's happening though is there's too much motion at a specific segment of the spine. And if you can do that subtle slouch motion, you can put the spine into more of a normal curvature that it's supposed to have here. Another problem related to this is that flat back happens as a result of a compensation because you're usually too stiff up here and too stiff down here. And so that part of the back that straightens up, the muscles that are going right over that area are prone to becoming overused. And some people will even try to straighten up their posture because they're thinking, my back hurts, it's probably because of my posture, and I have a desk job on top of that. I work at the computer all day, and so I probably have bad posture. But what actually needs to happen in these individuals is you need to sit and stand in a way where you're subtly slouched. And it's even okay to lean on the desk, put your forearms, your wrists, even your elbows on the elbow rests of your chair or on the desk, and allow the chair or the desk to kind of shove your shoulders up, because that'll also help to unload the spine, unload the disc in the area. So lean on the desk and do a little bit of a slouch as you begin to work. Now, long term, this could have some negative implications for your neck, but you're probably on this video because you're looking for help with T4 syndrome, because it can get pretty bad, that back pain. So I think it's a good trade-off in the short term to do this slouch motion to allow that T4 area to heal. And of course, later on, you'll be able to fix the long-term problem, which is what we're going to talk about next. Healing T4 syndrome for the long term requires addressing the root muscle imbalances, which there's usually two involved. There's usually weak upper trap muscles, or the shrugging muscles, the ones that help you to shrug up like this. When those muscles get weak, they cause the joints in the upper part of the spine here to get stiff and stuck. And then weak abdominal muscles here cause the lower part of the back to get stiff and stuck. and that's what ends up causing excessive motion in the mid part of the back where the T4 syndrome happens. We've got a playlist of videos called T4 Syndrome Help. You can find it linked in the description below. Go check that out to learn more. Hey, if you thought this video was helpful, please give us a thumbs up, and please share this video with somebody you think needs to see this. Also, please subscribe to our channel if you haven't already, and turn on our notification bell so that you don't miss out on any of the helpful videos we put out every single week. Thank you so much for watching. I'll see you in the next video. Bye-bye.